After 17 years at the Helen Joseph Hospital, renowned breast cancer surgeon Professor Carol-Ann Benn has left the facility. She established the Breast Health Foundation, an NGO that's helped thousands of cancer patients through their treatment journeys. Professor Benn says she faced continued harassment for doing things outside the box. She says healthcare is not about ticking boxes, it's about caring for patients. Helen Joseph Hospital has been quick to try and reassure patients that their care won't be affected, but patients have been voicing their concerns about Benn's departure. Professor Benn says she's heartbroken to have left the hospital, and she joins us now for more. Thank you so much for your time, Professor Benn. You've been quite literally saving lives at Helen Joseph for, as we said, well over a decade, and now you've resigned due to what's been termed in the media unsavoury working conditions. Can you tell us a little bit more about exactly what those conditions are like?
Well, let's just say that I didn't fit the government box. So for me, it's about making sure every day that when we look someone in the eyes, we're offering them proper cancer care. So sometimes to do that, you need to take initiatives. You need to bring in source things that possibly from private. You need to set up foundations. You need to assist patients in any way because the treatment is very fragmented. And, someone knows if they've got a lump in their breast. And I always think the reason why people battle to come in is our environments are so hostile for patients. So let me say that just created a whole lot of unsavory being called out of clinics, meetings, WhatsApp groups of own up, why are you doing this? So it just became really too much. And it's not that I'm not going to continue looking after government patients. I really believe there is a better way, and we have to find ways to manage patients and manage them properly, not make excuses every day why we can't do their operations, or because we're looking them in the eye. And these women are in quite tight windows if they're coming off chemo and they need their surgeries. So we went through the whole of lockdown with having no outstanding cases. I literally was doing 3 lists a week. Patients were up to date and sorted, and repeatedly saying to people, we need help. We need to change our systems. So I just had to figure out a better way to do it.
So bureaucracy and operational limitations, are they preventing the hospital from giving quality care? Is that also essentially what you're saying?
So I think it's very hard. Government systems are a little bit like the Gulliver's Giant. There's so many reporting structures. If there's no equipment, it has to be dealt with this department. If there's no, and then everyone's reporting into little ones and turning around and making it someone else's problem. And I think that you can change those systems to ensure a better quality care. So if, for example, you're responsible for a unit, you need to take responsibility. You need to make sure that you are sourcing things. We'd often source things from other hospitals, and just to make sure that we are offering a good service, because the healthcare is about, in my opinion, everyone having access to good healthcare service. It's a human rights issue.
So patients voicing their concern, saying you're going to leave a massive gap, and no doubt you are. Volunteers who worked at the hospital for the foundation that you founded also standing up with you and leaving in solidarity. Yet Gauteng Health Department spokesperson said that the clinic will continue to run without you. What do you think is going to happen to those patients? And we know that you have such an incredible heart for the people that you serve.
So I think, geez, this is hard. I'm seeing a lot of the patients off-site, and we are servicing their surgeries off-site. So we're coming up with ways, and it's not that we have abandoned the patients. The foundation is still doing things online. It was just at that particular unit, it just became impossible to continue in the way we were. So, my phone is going berserk. I've been WhatsApping in. I see patients off-site, and there are better ways. There have to be better ways. I'm very pro an NHI concept, and people say it can't work. It can work if doctors and clinicians realize they're there to provide a service, not to drive a sports car. And if you salary in people, look at the low-end medical schemes, come up with ways that we can treat more people cost-effectively but properly.
So you have this incredible passion for public healthcare and for making sure that people who have no other means of getting the kind of healthcare that they need get it within the public system. But as you've said, the public system doesn't work all that well. We see a lot of doctors also choosing to work overseas because of the system here. And we've seen so many reports of especially Gauteng public health facilities being in a state of crisis at the moment. Doctors speaking out about systems not working, about infrastructure that's absolutely crumbling, and that the patients are at essentially the mercy of these hospitals, and that they don't, get more seriously ill at these facilities instead of getting better is a miracle. What do you think needs to happen overall for healthcare in Gauteng and across the country to be drastically transformed?
Well, I think you have to combine in your lower medical schemes with your government patients and salary and doctors to set up a system. I often use healthcare. It's a bit like being on an airplane. So you have so many seats in first and business and whatever the premier economies, and all those people will have very few co-payments. But the vast majority of people on medical schemes have massive hospital co-payments. They have doctor co-payments. So I think if we restructured that group with the government patients, you could offer a better service where you run clinics and you offer surgeries and treatment, deal with things like radiation delays, and that it would be far better if you combine that bulk and offer it into, but we need clever business people to sort out the how. But I do think there are lots out there, not a blonde, but we need a better system, definitely.
And is there anything that you want to say to the patients at Helen Joseph who you won't be seeing necessarily anymore unless you see them outside of the clinic?
Yeah. So I think they must push for right to proper treatment. So if you arrive at the clinic and you're not getting treatment and you're being turned away, then we need a voice. I did a lecture and where I spoke about the big five in cancer. I like the analogy. And we need to roar like a lion. We need to have a voice of awareness, know where to access. That's the leopard. You've got to find the hard to access healthcare services because the treatment's hard. It's the buffalo. Service is our rhino. We want to be able to service people and not land up with nothing there. So we have to push for it. And sometimes inside a structure, you can't do that because if you're not following the rules of the structure, then I say I'm a little like Cinderella's ugly sister's big foot. I don't fit that shoe. And then if you keep on trying to get your foot into the shoe, it's not going to work. So we have to come up with better ways.
We have to find different shoes. Thank you so much, Professor Carol-Ann Benn, not only for the work that you've done in saving so many lives and the work that you continue to do in healthcare. Thank you very much for speaking to us, Professor Carol-Ann Benn, exceptional breast cancer surgeon.